First and foremost, Professor Audu has made it very clear that most of our researches are in silos. In other words, people are doing research in different parts of the country, but it's not systemic. It is not properly institutionalized. And so clinicians tend to get engaged in research for different type of cancers. But we don't have a national concerted effort to do a strategic research. For example, let me give you an example of the liver cancer. We know that one of the real causes of liver cancer is the hepatitis virus. Now, how much of hepatitis virus do we have in this country? We don't know. We haven't done any research around that. We will want to know, we will want to have a national program on screening of the hepatitis virus, hepatitis B and C. You know, it was the number one cancer in Egypt, but they were able to screen over 60 million people, and that brought down the prevalence of liver cancer by almost 80%. So that is a concerted, planned research, and this is the kind of research that we'll want to see also in Nigeria. The kind of the human papilloma virus that is responsible for cervical cancer is defined in many parts of the world, but how much of those strains that cause the cervical cancer are really prevalent in our environment? Do we have other strains that are really not covered, for example, by the vaccine? So these are kind of national planned research that we'll also want to see. So in that vein, I mean, a lot of work has been done around the globe, and most of the institutions that are involved in collaboration must have had one form of research in this direction to be able to guide us. So we are not inventing the wheel, but we want to have those data in our environment in Nigeria to be able to say, yes, this is the prevalence and this is the strategy we are going to use to mitigate it. The idea of research anywhere in the world is to be able to have proper data for that environment that will determine the kind of outcome that you will be expecting as a result of those research that you have done. If, for instance, we are trying to eliminate cervical cancer, right, and we are giving the human papilloma virus vaccines, and we know that what Nigeria is using is the quadrivalent vaccine. That means it covers 4 strains of the human papilloma virus. But there are other oncogenic viruses, those that are also going to cause cancer, right? That's why they are called oncogenic. So we'll want to know how many of those are really in Nigeria that are not really covered. We don't have that data. And it may surprise us, perhaps, that we will have more of those viruses that will cause cancer that are not covered on this vaccine, even though it's a global thing, but it's statistical deduction that yes, strain 11 and 16 are the real culprit, or 18 as it were are the real culprit, but there are others. So that kind of research is the one that we want to see. And I'm happy to note that the newly formed National Cancer Institute for Research and Treatment is also trying to collaborate with us at the Federal University of Health Sciences to see how we can develop some national questions, national hypotheses around these things to drive the research that will be of national interest.